Have you ever felt like your body was trying to tell you something, but you just couldn't quite make out the message? You're tired all the time, your legs swell up. Climbing a flight of stairs feels like scaling a mountain. And deep down, you wonder, is this just aging or is something more serious going on? Hi there and welcome back to Age Stronger, the channel where we help you live healthier, stronger, and smarter with every passing year, no matter your age. In today's video, you'll learn what heart failure actually means and what it doesn't. 6 root causes that slowly wear down your heart. 4 essential tests your doctor may recommend, and why early detection matters. 5 powerful treatment strategies that go far beyond just taking medication. These are the key things we'll be diving into today, and trust me, they could change how you see your heart health. But before we begin, don't forget to like, share, and subscribe to Age Stronger. Your support helps us keep making honest, helpful videos just like this one. Alright, let's get straight to the heart of the matter. What heart failure is and what it isn't. When people hear the words heart failure, it often triggers fear images of a heart that stopped beating or the idea of a death sentence hanging over their heads. But that's one of the biggest misconceptions, and it's also why many patients live in unnecessary anxiety instead of focusing on what they can do to treat the condition. According to the Mayo Clinic and Cleveland Clinic, heart failure doesn't mean your heart has stopped working. What it really means is that your heart isn't pumping blood as efficiently as it should. As a result, oxygen and nutrients aren't getting to the rest of the body as effectively, which can lead to symptoms like fatigue, shortness of breath, swelling in the legs, and reduced ability to do daily activities. Types of heart failure, not all are the same. Not every case of heart failure looks or feels the same. In fact, understanding the type of heart failure you have is crucial to managing it well. 1. Left-sided Vs. Right-sided heart failure. Left-sided heart failure is the most common form. It occurs when the left ventricle, the part of the heart responsible for pumping oxygen-rich blood to the body, becomes too weak or stiff. This causes blood to back up into the lungs, leading to shortness of breath, especially when lying down or during physical activity. Right-sided heart failure, on the other hand, often develops as a result of left-sided failure. When pressure builds up in the lungs, the right side of the heart struggles to keep up. This can cause blood to back up in the veins, leading to swelling in the legs, ankles, and even the abdomen. 2. Systolic versus diastolic dysfunction. In systolic heart failure, the heart muscle doesn't contract forcefully enough to pump blood out efficiently. This is the most common type and is typically associated with a reduced ejection fraction. Diastolic heart failure, however, happens when the heart muscle becomes stiff and doesn't relax properly between beats. As a result, the heart can't fill with enough blood, which limits how much is pumped out to the body, even if the contraction itself is strong. 3. Acute versus chronic heart failure. Acute heart failure comes on suddenly and can be life-threatening. It might be triggered by a heart attack, severe infection, or a negative reaction to medication. It usually requires urgent medical care. Chronic heart failure develops over time. Many people live with it for years, even decades, especially when they're under proper treatment and lifestyle management. The word failure isn't the whole story. Let's face it, the word failure sounds terrifying. It makes it feel like your heart has completely given up. But in reality, most people with heart failure still have a heart that's beating, just not as efficiently as it used to. Think of it like an old car engine. It still runs, but it might need more maintenance, burn more fuel, or overheat under pressure. Your heart is the same. It's still working, but it's struggling under a heavier load. That load might be caused by high blood pressure, clogged arteries, diabetes, obesity, or simply the natural wear and tear of aging. As one analogy puts it, your heart is like an engine. It's not broken, but it's straining under the weight. And that weight, it can be managed, treatable, manageable, not the end. Here's the most important message to take away: heart failure is not the end. With today's medical advances, heart failure, especially when caught early, can be treated and controlled. Millions of people are living long, fulfilling lives with a heart failure diagnosis, thanks to daily medications, lifestyle changes, and a proactive attitude. You don't have to live in fear. You don't have to give up the activities you love. What you do need is the right understanding of your condition, a strong relationship with your doctor, and the belief that even a weakened heart can carry you through many more meaningful years. The root causes why the heart begins to weaken. Heart failure doesn't happen overnight. It's not the result of a sudden collapse, but rather a slow, quiet process that often develops over years, sometimes even decades. During that time, the heart endures repeated stress and damage from underlying conditions like high blood pressure, clogged arteries, or irregular heart rhythms. Each time the heart is strained, even slightly, its ability to pump blood effectively takes a small hit. Over time, those small hits add up, weakening the heart and making it harder for it to deliver the oxygen and nutrients the body needs to survive. According to Healthline and Harvard Health, here are some of the most common root causes of heart failure. 1. Coronary artery disease, the heart's silent enemy. Coronary artery disease, CAD, happens when the arteries that supply blood to the heart become narrowed or blocked due to plaque buildup. When the heart muscle isn't getting enough oxygen-rich blood, it can't function properly. Over time, this leads to reduced pumping power and lasting damage to the heart muscle. Many people have no idea they have CAD until they experience chest pain or suffer a heart attack, one of the leading triggers for heart failure. 2. High blood pressure, the hidden strain on the heart. High blood pressure forces the heart to work harder to push blood out into the body. Over time, the heart muscle thickens, then weakens, just like someone who's been lifting heavy weights for years without rest. Eventually, the muscle loses its flexibility and pumping strength. Real-life example. A 68-year-old woman was rushed to the ER with severe shortness of breath, dangerously high blood pressure, and swollen legs. She had lived for years with untreated hypertension. By the time she got help, her heart was exhausted and could no longer keep up. Doctors diagnosed her with acute heart failure and had to act fast to preserve what heart function remained. 3. Diabetes, a slow, steady drain on heart health. People with diabetes, especially older adults, face a much higher risk of developing heart disease. Constantly high blood sugar levels damage blood vessels and the nerves that help regulate heart function. Diabetes also increases the risk of high blood pressure, high cholesterol, and arterial plaque buildup, all of which contribute directly to heart failure. Unfortunately, many people don't realize the damage until the heart is already struggling. 4. Valve disease, when the heart's doors malfunction. The heart's valves act like gates that control blood flow through its chambers. When valves become stiff or leaky due to age, infection, or congenital defects, the heart has to work harder to keep blood moving in the right direction. That extra workload can wear the heart down over time. If valve problems aren't treated early, often through medications or valve replacement surgery, they can lead to full-blown heart failure. 5. Arrhythmias, when the beat falls out of rhythm. A healthy heart beats with a steady rhythm. But if the heart beats too fast, too slow, or erratically, its ability to pump blood efficiently is compromised. One of the most common arrhythmias in seniors is atrial fibrillation, which causes blood to pool in the heart chambers. That can lead to blood clots and eventually weaken the heart muscle. Symptoms like fatigue, lightheadedness, or shortness of breath during activity may be signs that your heartbeat isn't in sync. 6. Lifestyle habits, small choices, big consequences. Smoking narrows blood vessels, lowers oxygen in the blood, and increases the heart's workload. Excessive alcohol can directly damage the heart muscle. Poor diet, especially one high in sodium, saturated fats, and added sugars, leads to weight gain, high blood pressure, and high cholesterol. Lack of physical activity weakens the heart and increases the risk for obesity, diabetes, and coronary artery disease. These habits don't always cause immediate damage, but over time, they're like drops of water filling a cracked glass until one day, it spills over and the heart breaks. One of the most dangerous things about heart failure is how silently it develops. Many people live with it for years, brushing off symptoms as just getting older or just a little tired. This false sense of normalcy allows the condition to quietly progress until symptoms become severe and harder to manage. That's why early recognition and proactive care are so important. Why this matters? Once you understand what weakens the heart, you're in a much stronger position to prevent it or manage it. Heart failure doesn't have to be inevitable. With awareness, routine checkups, and a few smart changes to your lifestyle, it's entirely possible to slow or even reverse the course of the disease, especially in its early stages. Knowledge isn't just power, it's protection, and your heart deserves nothing less. Silent signs when the body whispers before it screams. Heart failure doesn't always begin with dramatic chest pain or a frightening collapse. In fact, it often starts quietly, with subtle symptoms that are easy to overlook or chalk up to just getting older. The truth is, your body doesn't scream at you right away. It whispers. And if we don't pay attention, those whispers can turn into urgent cries for help. Persistent fatigue, the most overlooked warning sign. Many older adults assume that feeling worn out after grocery shopping, gardening, or even a short walk is just a normal part of aging. But when fatigue becomes constant, when rest no longer helps, it might be the first real sign of heart failure. When the heart can't pump enough blood, your muscles and organs don't get the oxygen they need. That makes even simple tasks like getting dressed or having a long conversation feel exhausting. Shortness of breath, especially when lying down. One hallmark symptom of heart failure is trouble breathing when lying flat. This happens because fluid builds up in the lungs when the heart isn't pumping blood effectively. Many people find they need to sleep with extra pillows or wake up gasping for air at night, sometimes with a dry, unexplained cough. If you're more comfortable sitting up to breathe or can't sleep soundly lying down, that's a red flag. It's not just aging, it's time to talk to your doctor. Swollen legs and ankles, a sign of fluid buildup. When the heart isn't pumping efficiently, blood can back up into the veins, especially in the lower body. This causes swelling in the legs, ankles, or abdomen, often noticeable by the end of the day or after long periods of standing or sitting. Many seniors mistake this for arthritis or just old age. But if the swelling lingers, worsens, or feels heavy and tight, it may be more serious. Frequent nighttime urination, an unexpected heart clue. Many people with early-stage heart failure find themselves waking up 2-4 times a night to use the bathroom. Why? Because lying down increases blood flow to the kidneys, which leads to more urine. Though this symptom is also common with an enlarged prostate or diabetes, it can be an early sign of heart failure, especially if you also experience fatigue, swelling, or shortness of breath. Sudden weight gain, your body holding onto fluid. Gaining 2-5 pounds in just a few days, without changes in diet or activity, isn't fat. It's often retained fluid, a classic sign of heart failure. Keeping track of your weight daily is one of the best ways to catch this early. If you notice a steady increase of more than 2 pounds in 24 hours, or 4 or 5 pounds over a few days, it's time to call your doctor. Brain fogs when the brain doesn't get enough blood. When your brain doesn't receive enough oxygen-rich blood, you may notice trouble concentrating, short-term memory issues, or just a feeling that your mind is foggy. Some describe it as feeling like their brain is in a haze or their thoughts are harder to organize. This isn't just aging, it could mean the heart isn't sending enough blood upstairs. When should you see a doctor? If you or someone you care about has 2 or more of these symptoms, or if any one of them worsens over time, don't wait. A visit to a cardiologist could make all the difference. Catching heart failure early opens the door to treatment, management, and a better quality of life. Those with a history of high blood pressure, diabetes, coronary artery disease, or a past heart attack are at even greater risk. Regular checkups can help detect heart failure before it becomes severe. Early detection equals longer, healthier life. Early diagnosis doesn't just improve your health, it protects your independence and daily life. Studies show that when heart failure is diagnosed and treated early, hospitalizations and serious complications can be greatly reduced. Your body is always sending signals. The real question is, are we listening in time? When it comes to heart failure, delay is a luxury you can't afford. Paying attention to those quiet whispers could change the course of your entire future. When a doctor recommends a heart evaluation, it's normal for older adults to feel anxious. Does this mean something is really wrong with my heart? Could I have a serious condition? If I'm diagnosed with heart failure, is it too late? But here's the truth: getting a diagnosis isn't something to fear. It's an opportunity, a chance to take control of your health before things get worse. Instead of panicking, think of the evaluation as an honest conversation between you and your heart. It's your chance to ask, what do you need, and what can I do to help you keep going? What to expect at the doctor's office. If your doctor suspects heart failure, they'll start with a detailed conversation about your medical history and symptoms. They may ask, do you often feel tired or short of breath? Have you noticed swelling in your legs? Do you wake up at night gasping for air? Are you currently taking medications for high blood pressure, diabetes, or cholesterol? Next comes a physical exam. Your doctor will check your blood pressure, listen to your heart and lungs, and look for signs of fluid buildup, like swelling in the ankles or abdomen. These are important first clues that guide what comes next. Common tests to confirm a diagnosis. 1. Electrocardiogram ECG or EKG. This painless test records the heart's electrical activity using small patches, electrodes placed on your chest. It helps detect irregular heartbeats, signs of past heart damage, or poor blood flow to the heart muscle. Think of it as a way to check if your heart's rhythm is in sync or if it's sending distress signals. 2. Echocardiograms. This is the most important imaging test for diagnosing heart failure. It uses ultrasound to show real-time images of your heart beating. Doctors can see how strong your heart is pumping, whether any areas are weak, and if your heart valves are leaking or narrowed. Imagine it like a video of your heart in action, helping your doctor see if it's working hard enough to keep up. 3. BNP or NT-proBNP blood test. This test checks for a hormone called BNP, which the heart releases when it's under stress. High levels suggest that the heart is struggling to pump properly. In simple terms, it's like your heart sending up a flare saying, "I'm overwhelmed, help me out." 4. Stress test, exercise, or medication-based. If more information is needed, your doctor might order a stress test. You'll either walk on a treadmill or receive medication that simulates physical exertion while your heart is monitored for changes in rate, rhythm, or blood pressure. This test shows how your heart handles pressure and can uncover hidden issues like blocked arteries or early-stage weakness. No panic necessary, you're taking the right step. Being diagnosed with heart failure isn't a life sentence. It's a roadmap. It helps your doctor determine which treatments will help, what lifestyle changes to consider, and what to keep an eye on moving forward. And most importantly, knowing your condition gives you the power to act. Avoiding the doctor, ignoring symptoms, or assuming it's just old age only gives the disease more time to progress quietly. Be proactive, not passive. Getting a diagnosis doesn't make you weak. Taking action does. That's what makes you strong. Track your daily symptoms. Ask your doctor questions, there are no dumb ones. Get the tests you need when you need them. And above all, believe that you can be in charge of your own heart health. Because clarity begins with action. And action begins when you choose to listen to the small signs before they become serious problems. Heart failure isn't a sentence, it's a journey. And managing it well doesn't begin and end with your medicine cabinet. In truth, treating heart failure effectively takes a whole-person approach, blending medication, lifestyle changes, cutting-edge technology, and most importantly, your active involvement. Every heart has its own story, which is why treatment must be personalized. One medication's the foundation of every treatment plan. For decades, certain medications have been proven to help people with heart failure live longer, feel better, and stay out of the hospital. ACE inhibitors like enalapril or lisinopril help relax blood vessels, making it easier for the heart to pump blood. They also slow down long-term damage to the heart. Beta blockers like carvedilol or bisoprolol lower heart rate and blood pressure, easing the heart's workload. Over time, they can even improve heart function. Diuretics such as furosemide or torsemide help your body get rid of excess fluid, which reduces swelling and shortness of breath. SGLT2 inhibitors like dapagliflozin or empagliflozin, originally developed for diabetes, have now shown powerful benefits for heart failure, even in people without diabetes. Most patients need a combination of these drugs, and dosages must be carefully adjusted by your healthcare provider over time. 2. Lifestyle changes, the true game changer. If medications are the foundation, lifestyle is the structure built on top. Making small but meaningful changes can take a huge load off your heart. Low-sodium diet. Cutting back on salt helps prevent fluid retention and keeps your blood pressure in check. Avoid processed foods, canned soups, cured meats, and salty sauces. Daily weight tracking. Gaining just 2-4 pounds in a few days could be a sign of fluid buildup. Weigh yourself each morning after using the bathroom, before eating, and jot it down. Gentle exercise, like walking 20-30 minutes a day, helps your heart get stronger, improves circulation, and lifts your mood. The key is consistency. Move a little every day. Limit alcohol and quit smoking. Both can directly damage your heart and blood vessels. Cutting back can dramatically improve your heart's performance and reduce flare-ups. 3. Medical devices when the heart needs a helping hand. In more advanced cases, or when heart rhythm problems are involved, your doctor may recommend certain heart devices. Pacemaker. Helps regulate slow or irregular heartbeats, keeping your rhythm steady. ICD, implantable cardioverter defibrillator. For those at risk of sudden cardiac arrest due to dangerous arrhythmias, this device can deliver a life-saving shock. CRT, cardiac resynchronization therapy. Helps both sides of your heart beat in sync, improving blood flow in people with inefficient heart pumping. These devices are implanted through minimally invasive procedures and monitored regularly to ensure they're working as intended. 4. Surgery addressing the root cause. Not every heart failure patient needs surgery, but when the underlying issue is structural, surgery can make a big difference. Heart valve repair or replacement. Fixes leaky or stiff valves that strain the heart. Coronary artery bypass surgery, CABG, restores blood flow to the heart muscle when arteries are blocked. Repair of congenital defects. Rare in older adults, but some may have undiagnosed heart abnormalities that can worsen with age. Doctors only recommend surgery after a careful risk-benefit analysis based on your overall health. 5. Personalized care, because every heart is unique. There's no one-size-fits-all treatment for heart failure. What works for one person may not work for another. That's why your care plan should reflect your lifestyle, preferences, and goals. The bottom line, it's not about doing everything, it's about doing what works for you. Managing heart failure doesn't mean overhauling your life overnight. The goal isn't perfection, it's progress. It's about finding the changes that work for your body, your rhythm, your world. A simple, sustainable plan, supported by your doctor and loved ones, can help your heart keep beating strong for many years to come. Heart failure doesn't just affect your body, it reaches deep into the human spirit. When someone is diagnosed with a chronic heart condition, they aren't just dealing with pills, blood pressure numbers, or daily weight checks. They're also facing uncertainty, fear, and often a quiet loneliness that few people ever see. According to Harvard Health and the Mayo Clinic, people living with chronic conditions like heart failure are at increased risk for depression and anxiety. And it makes sense, every day brings questions without easy answers. How long do I really have? Am I becoming a burden to my family? Do people think I'm weak now? The invisible weight that doesn't show up on a prescription. One of the hardest parts of living with heart failure is the fear of dependence. When everyday tasks, like going to the store or cooking dinner, require help, many people feel like they're losing a piece of who they were. They may still look the same on the outside, but inside they feel like they're becoming someone else. And then there's the quiet shame, because the body just doesn't cooperate anymore. A man who used to be strong and capable now feels winded walking across the room. A woman who was once fiercely independent finds herself rushing to the bathroom because of diuretics. These stories are common and often untold because nobody wants to feel pitied. But that silence only adds to the isolation. Feeling scared doesn't make you weak, it makes you human. Your emotions are not the enemy. Feeling anxious or down doesn't mean you're not strong, it simply means you're reacting to a life-changing diagnosis. In fact, these emotions show that you still care, that you still have hope, that you're still fighting, and that's worth something. Tools for mental health, caring for the heart within. The good news is there are real effective ways to care for your emotional well-being while managing heart failure. Talk therapy. Speaking with a counselor doesn't mean you're broken. It means you're wise enough to ask for help. Just a few sessions can help you process your fears and regain a sense of control over your life. Support groups. Whether in person or online, connecting with others who are also living with heart failure can be incredibly healing. Their stories remind you you are not alone, you are understood. Stay socially connected, don't disappear into isolation. A phone call, a short walk with a friend, a coffee with your neighbor, small moments of connection are powerful medicine for the soul. You are still you, even if your heart is struggling. Heart failure might slow you down, but it doesn't erase who you are. You're still a parent, a friend, a neighbor. Feeling sad, overwhelmed, or uncertain doesn't make you fragile, it makes you real. And like any storm, emotional pain can pass. But it starts with acknowledging it, taking care of it, and not walking the road alone. So let me ask you something. Is heart failure the end of the road? Or could it actually be your second chance to live smarter, love deeper, and reconnect with your body in a more meaningful way? The truth is, your heart may be weaker, but you are not. You are not broken. You are not alone. And you absolutely don't have to walk this journey in fear. If this video helped you feel a little calmer, a little more informed, or just a little more hopeful, take a moment and share it with someone you care about. You never know who's quietly struggling with the same questions you've asked yourself. And don't forget, like, subscribe to Age Stronger, and turn on the notification bell so you never miss a video that could change your life or someone else's. At Age Stronger, we believe aging isn't fading away. It's stepping forward with strength, wisdom, and purpose. Until next time, take care of your heart, and even more importantly, take care of yourself. We'll see you in the next video.